Tonight I'm going to talk about common eye injuries and diseases. Now, if you're not a fan of close-up pictures of eyes, this might not be the talk for you. So what we'll do first is run through some of the most common signs and symptoms of eye pain. So we've got things like squinting, which is partial or complete eye closure. There can be discharge. This can be sort of watery tears, or it can be thick mucopurulent discharge. There can be swelling of the eyelids, the conjunctiva, or both. They often have a bit of a painful expression. The pupil is constricted, and there can be changes in the color and texture of the eye. A more subtle sign is that the eyelashes can be pointing more vertically. We'll get to that in a second. Oh no. Hang on, technical difficulties. There we go. Okay. So this is an example of one of the classic eyes that you'll see. We've got a painful expression with this sort of wrinkling of the eyes here. The eyes only partially open, and we sort of have this copious watery discharge. And this was secondary to an ulcer. Here we have a different eye. So this is more of a really swollen eye. So we've got swelling and reddening of the conjunctiva. We've got some mucoid discharge. And I think you should be able to see there's sort of some changes in the texture of that eye there. Now this is quite different to the other one, but was also an ulcer. This is the eyelash thing. So we're looking at the horse's left or normal eye. The eyelashes are sort of a little bit more horizontal than these ones, which are pointing more vertically. The eye is a little bit more closed in this one. And this is more of a subtle sign of eye pain. Sometimes you won't see it from looking side on, so it's best to look from the front. And this can be more classic for conditions such as uveitis, which we will get to in a bit. So there's quite a few common eye injuries and diseases. I've only got sort of 15-20 minutes, so we can't go into too much detail. But I thought we'd just run through a few examples. Not everything with eye pain is an ulcer, and some of the take-home messages for each. So with corneal ulcers, these are probably the most common thing we see. Now, a cornea has layers like an onion or a ogre. There's 5 layers. So there's the epithelium, which is the outermost layer. Then we have Bowman's, the thick stromal part, which is the middle part, Descemet's membrane, and then the last bit is the endothelium. So ulceration occurs when there's damage to either just the superficial epithelium or traversing all the way down to the endothelium. When we get to the endothelium, we can get in a little bit of grief because the eye is pretty close to rupturing. And sometimes what can happen with ulcers, if it's deep enough to get into the stroma, the infection can form an abscess in that thick stromal layer. So the way that we normally detect ulcers, apart from the signs and symptoms, is using fluorescein stain. This is an orange stain that turns green once it hits the tear film. And it actually sticks to any sort of damaged layer of the cornea, except the endothelium. And then sometimes we get a donut, which means that it's a bit deep. So ulcers can be tricky to talk about. So I tried to split it into simple ulcers, which are probably about 75% of the cases that I see. These are ulcers where there's just damage. They aren't significantly infected. And they tend to heal pretty quickly with treatment. Now, complicated ulcers are ulcers that have an infection. This can be bacterial or fungal or both. And these tend to heal a lot slower. There can be more complications and they require intensive treatment. Treatment for both normally consists of topical antibacterial or antifungal medications in combination with oral pain relief and anti-inflammatories like butane, flunixin. The difference is that the number of medications needed for complicated ulcers is generally more, and the frequency of those treatments, which we'll get into in a sec. So this is an example of a simple ulcer. So it's a case of size doesn't matter. The depth of the ulcer and the presence of infection are generally more important. So here we can see that's the same horse with that really swollen eye, that there's a really big area of stain, that fluorescein stain uptake. Now, what I think may have happened is a bit of grass or hay has got caught in the eyelid and act a bit like a windscreen wiper and just remove that top layer of epithelium. Now, this horse we did treat pretty aggressively with topical creams, and it responded really well because it was very superficial, didn't get the chance to be infected because we got onto it really quickly, and we had a great result. So the complicated ulcers can progress from simple ulcers, and this can be due to many different factors. Sometimes it's that the treatment's not being done frequently enough, that the bacteria is not sensitive to the treatment that we use. And sometimes we just get a really nasty bug. In particular, when we get those fungal infections, they don't respond to conventional antibiotics. So that's when we can get into a bit of grief. And sometimes it almost does seem to be bad luck. Despite the best efforts, you can medicate them 5 times a day with your creams, you're getting the bute into them, you're doing everything right. And for whatever reason, they can still progress. Sometimes this can be in the form of a non-responsive, non-healing ulcer. So the area of the stain uptake doesn't change, the horse is still painful, it's not getting worse, it's not getting better. Or sometimes they can deteriorate pretty quickly. An example of that is these melting ulcers, where the actual surface begins to slough off, which is pretty serious condition. So with the complicated ulcers, these are a little bit different in that they often require a subpalpebral lavage system, which is an SPL. This is a piece of tubing which we insert either in the lower or the top eyelid, and there's a little foot plate there, and we stitch it in to the head, and then we run it through some plaits in the mane, and then there's a little bung with a port at the end by the wither. And what this allows us to do is to push medications through this tubing into the eye without having to open their eye, touch their eye, which is really good for these really painful horses, especially with those intensive ulcers where you're putting meds in, can be up to 2 hourly with the really, really severe ones in hospital. These are pretty delicate pieces of equipment. You need a special mask to go over the top. They need to be boxed, and they need someone who knows what they're doing to maintain these so they don't break. And then sometimes in the really severe surgery cases, they may need surgery. So this can consist of a conjunctival graft, where a piece of the conjunctiva is actually stitched onto the cornea to heal it. Or sometimes if we don't have the budget, or it's just progressed or the eye has ruptured, we do need to remove that eye. So this is an example of an eye that took a long time, as you can see. So the top left picture shows this sort of diffused mottled appearance to the cornea that was suspicious of a fungal or diffuse bacterial infection. Now we hit it pretty hard with medications, and we did reduce the area. But as you can see, the area is smaller, but it's starting to get deeper. And then unfortunately, it did develop into one of the melting ulcers. You can sort of see that the surface of the cornea there is starting to melt. This one probably got just about as deep as they can get. And so obviously there was an SPL in, we hit it with antifungals, antibacterials, lots of pain relief. And 8 days later, we can see that the vessels have grown in from the conjunctiva to sort of form their own conjunctival graft and heal that ulcer. Now from this stage of the vessels growing into this stage of the ulcer being completely healed, took another 2 weeks. So this is just a bit of a awareness that those really complicated ulcers can be tricky to treat, expensive to treat, and they can take a while to get good results. So in this case, if the option of enucleation would have been viable as well. So that's the big scary talk about ulcers. So we'll get into some slightly less dramatic things. So foreign bodies are also something I see pretty commonly. The number one culprit is grass seeds or bits of hay. And often I see horses sticking their entire faces into round bales or hay. And I just think about all our grass seeds that could be going in. So the thing about these two, they're quite interesting, is that they show relatively mild signs of eye pain. Outwardly, there's no obvious, you can't see them. So it's really hard to see these without a proper examination with sedation and nerve blocks. And these normally present as sort of these weepy, slightly painful eyes that just don't improve even despite treatment. So for these, it's really important to always look in the conjunctiva and under the third eyelid. So I think hopefully these will work. So this one here.
Grass seed.
Pretty big.
Ouch, buddy.
And then this one. So you can see that they're pretty big, but you actually can't see them outwardly. So they obviously felt a lot better after that. So take-home message is, without a full ophthalmic exam, sometimes these will get missed. So conjunctivitis is another thing that I see pretty commonly. This is normally caused when there's irritation from flies, dust, allergies, or a blocked nasolacrimal duct. The horses then rub their eye, which causes some micro damage, and then they then get infected secondarily with bacteria. So the classic sort of severe conjunctivitis would be this one down here, where we've got copious amounts of mucoid discharge, mild swelling, and just constant tearing of the eye as well. Take-home message for this one is that fly control and fly masks are really important, particularly in summer and autumn with that dusty, dry weather we've been having. We had quite a lot of conjunctivitis, and using fly masks and things can also help prevent the spread. And so sometimes the treatment for this involves flushing the nasolacrimal duct, which is a duct that runs from the eye all the way down the face into a little opening in the nostril. And what we can do is use saline and actually flush that eye. And there we go. So that's good. And yeah. Another thing that can happen quite often is trauma. So on the left here, we have a pretty classic example of what I would call a black eye. These horses present with sudden severe swelling of the eye. Often we actually can't visualize the entire eye at the initial examination because the eye is so swollen, the eyelids barely open. So for these guys, it's really important to hit them with anti-inflammatories and then reassess them next day to check for things like ulcers that might have occurred secondary to the trauma. With these two, it's also important to check for any other signs of trauma, especially to the eye socket, because they can do that when they hit their head. Eyelid abrasions and lacerations also can be important because they affect the normal function of the eyelid. If they can't blink, they're more prone to ulcers. So if you have a laceration or damage to the eyelid that's impairing the normal function, we want to get that fixed as soon as we can to prevent any complications like ulcers and things like that. Okay, so another one we're going to talk about is acute uveitis. Now, uveitis is the inflammation of the uvea, which is a layer of the eye which contains most of the blood supply. Now, this can be a primary issue in that it happens just spontaneously by itself, but more often than not, it occurs secondary to another issue in the eye. This can be trauma, it can be ulceration, it can be a few other things. So here we've got a little bit of blue discoloration of the cornea here, a really quite small eye. This mare was really painful. There was no ulceration, but she did develop a uveitis from that trauma. So the most common signs we'll see is being very painful, tearing, swollen, and sometimes blue, sometimes yellow, white discoloration of the eye. Probably the take-home message for uveitis is that the treatment is fairly different from ulcers, and they often don't respond to the same treatment. And the treatment for ulcers, the treatment for uveitis is often can be made. The treatment for uveitis, we need to make sure that there's no ulcers, because that can exacerbate ulcers if we put steroids or things in the eye if there's an ulcer there. So it's really important to differentiate, have we got uveitis, or have we got ulcers, or have we got something else? The issue we get with uveitis is that after the initial injury ulcer, it can then start to reoccur by itself, resulting in a condition called equine recurrent uveitis. So equine recurrent uveitis is a little bit of a poorly understood disease. We think that it's a complex autoimmune disease. There's no single cause. And unfortunately, it needs fairly aggressive long-term management and treatment. It can cause secondary issues such as cataracts or glaucoma, this is an end-stage eye. And it is the most common cause of blindness in horses. So this horse was completely blind in this eye. This can be a really painful condition. So it's really important to identify it and try and get it under control. And there is a breed disposition. Appaloosas in particular seem to be affected by it the most. And then you have your Icelandics, and some warm bloods can be affected too. So the take-home message for equine recurrent uveitis is, if your horse sort of has this mild signs of eye pain, is mildly teary, maybe he's had a history of having ulcer or trauma, we probably need to see that horse and check that there's no signs of uveitis going on. Some other things we can get are cancers of the eye that can present similar to ulcers. So in this top right picture here, we can see this abnormal tissue on the corner of the eye. This was a presumptive squamous cell carcinoma. This is fairly prevalent in all breeds, but in particular, the Appaloosas paints horses with white faces and with chronic long-term UV exposure can be more susceptible. So putting UV masks on those white-faced horses can be really important. With these, it's also really important to check the third eyelid, which is actually this really quite big structure here, which normally you don't see within the eye, but by putting pressure on the globe, we can get it to come forward. And this is a really common site for squamous cell carcinoma as well. So this is actually the same horse. So I was checking here that there's no sign of the cancer on here too. And then this one down the bottom is a pretty nasty melanoma in a grey horse that was impacting the normal function of that eyelid. We also get sarcoids, lots of different forms, lumps and bumps. They can be flat, sort of hairless areas. This horse here has some sort of three raised masses here that are suspicious of sarcoid, and the concern being that this may start to impact the function of this eye here. We also have things like cataracts. Now, these are opacities of the lens. I think you can see these sort of bubble-like structures in this eye here. It's also an ulcer. These are things we often find incidentally. These weren't causing this horse any issues. I was here for the ulcer. It was just a good thing to point out to the owners if they weren't aware. They can be really highly variable. Sometimes they are tiny, and sometimes they can be fairly extensive. More often than not, they're present at birth, particularly in thoroughbreds, and don't cause any issues. It's just something to be aware of. This is why we always check horses' eyes at pre-purchase, so you guys are aware of any sort of cataracts or anything at the time of purchase. Where they can potentially be a little bit more problematic is when they're progressive. So say this horse has never had cataracts before, they're sudden, or I come back in a few weeks and they've gotten bigger, that can be sign of another issue such as equine recurrent uveitis. Varying degrees of vision loss, they have to be fairly extensive, but in those older horses, they can cause some areas of vision loss. And these are just pretty cool, so I put them in. These are Corpora nigra cysts. The Corpora nigra is this structure here at the top of the pupil. It's thought to help reduce glare on horses. And sometimes this structure can get cystic. More often than not, we just find these incidentally, again, either just at a general health check, we just notice that there's something there. And generally, 90% of the time, they don't cause an issue. They can become an issue if they are large enough to obscure the pupil, especially sort of in brighter lights, or if there's a secondary issue. Now, I'm not sure if you can see, but this horse also has some cataracts in this eye. So potentially this eye could be problematic. So some of the things we sometimes see with these are head shaking, spooking, refusing to jump, getting startled. When you're working around them, they don't seem to see you. So, it's not, sometimes it's not just behavioral, they may have an issue there. So I think that's it. I hope you enjoyed. And if you have any questions, please let me know. Although I'm not sure how.
Okay. We have actually got a few questions already. So thank you very much, Dr. Melissa, for that there. So I am just collating the questions. I'm going to answer one question. Someone's asked, what is the treatment of a sarcoid? No, that's another lecture, and that has got me an idea for a webinar, which leave with me. It's on my list now. I've got an idea for that one. So we'll come back to that. There's wide and varied treatments for sarcoids. So that's something that we couldn't cover in a session. So first question we have here is, would you recommend that a white-faced horse wear a fly mask all year round, Dr. Melissa?
It's tricky in Australia, especially here in Victoria, because our weather is completely bonkers, and sometimes it's sunny and sometimes it's hailing sideways. But I do think that getting a good quality high UV mask, I think there's some out there that's sort of 95, 98% UV blocking. I think that's a good start, not just a regular fly mask, because the UV prevention is really important. Now, with those white-faced horses, ideally, yes, probably, particularly if they have a white nose, as well as that can reduce the chances of things like squamous cell carcinomas, which can be common on the nose and around the eyelid as well. Obviously, the concern will be if they're rolling in mud. So I guess that's the, debate. But ideally, if you can check your horse regularly, they're not rolling face first in mud, or they're not rubbing their fly mask off, I think UV protection is important. And those white-faced horses as well, on their noses having, filter back or some sort of UV protection can be really important throughout the year, because I think we always get hammered by the UV pretty much.
Okay, that's great. And then the final question is, what is the ongoing treatment or prevention for uveitis? What would you recommend for horses that are prone to uveitis or have had a history of uveitis in the past?
So it can be tricky, which is why I just touched on it lightly. But essentially, whereas with ulcers, we'll treat them with things like bute, with these uveitises, we really have to try and settle down that inflammation. So after we've ruled out that there's an ulcer present, we hit them with basically corticosteroids. That would be the first line of treatment. So that could be creams or drops into the eye. There has been some work, and often, we'll do that if you can identify the flares early or identify the risk factor, getting that treatment in early before they go into a full flare where they're extremely painful. We can also use things like atropine to help dilate the pupil and make that eye more comfortable. There is also more treatment for more of the chronic horses with cyclosporin either drops. So what we would normally do is start off with the cyclosporin drops. And then if that has a good response, there is an implant you can get into the eye, which I think lasts a couple of years. And that can be a really good long-term solution for those horses that don't respond. Sometimes if it's very severe, recurrent, and can't get under control, and it's one eye, sometimes we can take the eye out because it is a really painful condition. And the horses, once that eye is out, pain-free, do really well with just one eye. There's horses out there show jumping. I think there's a horse that's blind out there jumping. So they do really well with one eye.